Is everybody ready? Yeah, last. Yeah.
These will ever be.
Yeah. Good morning, everybody, and welcome to this meeting of the Community Services Committee. If we could start with declarations of interest, please. Yes. Thank you very much. Good morning. We'll just wait for Councillor. We've just taken declarations of interest. Councillor Bennett, is there anything you would like to declare?
I should declare that as far as I know, I'm still a member of the shadow governing body of RCHT, although we haven't met in over a year.
Thank you. We can then move on to the minutes of the previous meeting, pages 1 to 6, please, to confirm as a correct record the draft minutes of the Community Services Committee held on the 30th of June.
Chairman, I have read these and I'm prepared to accept them as a correct record for the last meeting.
Thank you, Councillor Bilsbury. Second? Fine. Could we have a vote on that, please? Thank you. Those minutes are confirmed as a correct record. Can we move on to item 3, urgent items? There are just a couple of things I would like to mention. And the first is a very pleasant duty to congratulate Park House on the recent Care Quality Commission report, where they gained a good grading over every category, which is extremely pleasing, and I'm sure all the committee would like to join me in congratulating them and the wider support team. Also, I would like to tender the thanks of the committee, I'm sure, to Mrs. Tremarco, who has left us, and to thank her for all the good work that she has done while she was working with the Park House team. Moving on, I would just like to comment that the agenda does appear quite short, and I would like to explain that this is partly because the work on the elder care options analysis quite rightly went from this committee to full council for discussion, and this will be covered within the service development plan at item 4. And several of the other items, which would normally come in a review of actions from the previous meeting, will also be taken as part of the service development plan. Members will be aware that they haven't received the budget monitoring report that was marked to follow. This is being finalised as we speak, and members will shortly receive it. However, as we work through the service development plan, Mrs. Mompoloki will be giving us an update of any key financial areas that will be discussed at a later date. And I hope this is agreeable to everyone. So we'll now move on to item 4, Service Development Plan, which, as my colleague Councillor Mumford has noticed, was actually marked on your agenda item front page as being a service development plan for 15-16, and of course it's 16-17, but is correctly marked at page 9 moving forward. I would like, if we may, to take this area by area in a more structured form, as it's such a meaty report. And obviously, if anyone forgets and wants to go back a bit, do feel free. But I think if we start with every area and move forward, I will ask the officer with responsibility for that area to comment first and give us an overview, and also to twin it with the RAG rating that we normally have on the side of the report, which has not been given to us on this occasion. So if we could start with adult social care on page 10.
Chair, is one
Yes,
minor
Councillor
item
Bilsbury.
on page, is a correction, on page 7 at the top. It gives the date of this committee as 02/02/16, which is the 2nd of February 1916. I think we've moved on since then. Right on the top line, in Community Services, then the date is 02/02.
Could be this year.
Still this year, but it's the wrong month.
This is the date of this committee is given as 02, it's the 2nd of February.
Yes, indeed, well spotted. There are 2 eagle eyes around this table. Thank you very much. I think we could almost have a competition at this rate. Right. Is there anything else? No? Right. Can we now go to page 10? Community Services Service Delivery Plan for 16-17. Objective 1, adult, to ensure that vulnerable adults are protected from harm.
Okay, thank you. Good morning. So this objective is all about making sure that our safeguarding statutory responsibilities are met. These are all green. There's nothing here that I need to report as an exception. We've got and for the first one, 1.1, we've got a peer mental programme in place with the LGA and ADAS, which stands for the Association of Directors of Adult Social Services. I have a monthly phone call with a mentor, and Fran is doing some peer work with Jim McKenna from Cornwall Council, which I think is going really well. Then we did a huge project, as you know, for 1.2, which is all about the new adult social care database. So not only will that give a much more accurate record of the assessment and planning work we do, but it'll also really improve the billing processes, because I think some of you remember in the past we've had some hiccups at kind of drawing in money in a timely fashion. We've done this really well within budget, but it's taken a long time because our adult social workers have done most of the work, but the migration is now complete. We've just had an independent audit of safeguarding work at 1.3. We had 6 cases audited. I think Cornwall had about 30. RCHT had a couple done, and Cornwall Foundation Partnership Trust had about 6. Ours were graded as 3 were good and 3 requires improvements. So we will develop an action plan to make sure that all of them are good in the future. The requires improvement, the quality of assessment and planning was strong. There are just some technical bits that we need to resolve on our database, and also how we interpret some of the wording in the Care Act. But in terms of meeting service user outcomes, we were really good. I can forward you all a copy of the audit report if you so wish. Community Safety Partnership, there's been a bit of a change because, as you know, there's been some staffing changes within the local authority. So when I was looking about how we allocate resource to it, the most sensible person to take leadership of this now is Lynn Plummer, who actually works in children's services. So I just need to resolve how that then gets reported to you. Community Safety Partnership doesn't need to come here, but we have tended to just give you updates. But that's still progressing well. A big focus of the funding for that is around domestic abuse. Then objective 2, supporting older people to lead independent and fulfilled lives. This basically is making sure that we've got commissioned services that meet the requirements of the Care Act. On 2.1, we have to have a universal and comprehensive advice, information and guidance offer, and that's been completed, and we did that in partnership with Healthwatch, and they were very, very helpful. 2.2, this is about reviewing all the projects that we've commissioned through the Better Care Fund. That's underway at the moment, and I will see if we can get a Health and Wellbeing Board set up later this year to review Commission's activity and decide priorities for the next financial year. And then on Buzzabus, members will be aware that I brought a paper saying that I would like to recommission the service. We've got issues with the reliability of the current vehicle, and that we could simplify the offer so that the council doesn't hold responsibility for the garage, say, and collecting income, and actually we find a provider that can take the whole lot on. Having looked at the contract, do you need me? So having looked at having looked at the contract, Colin, did you want to say something now? Sorry.
Well, I wondered if it was all right to interrupt you, or do you want to go through the whole thing first?
Up to the chairman.
Well, I think we'll have a pause in a minute, shall we? Because that's covered quite a lot of ground. It's just that Ashley has the responsibility for obviously quite a lot of this service development plan. So, would you like to take a question from Councillor Daly
Yeah,
now?
absolutely.
Thank you, Chairman. I received, along with other recipients, an email on the 7th of October about off-island care workers, that the training of them is now going to be paid for by the council, and all the boats want to come over here for the training, and there's going to be a new poster. I'm just wondering what progress there is on that.
I'll chase that up. a new poster should have been developed and sent to all of you. But so just to update you, this is not linked to Buzzer Bus, but basically, as you know...
No, it was the item.
Yeah, we have had a standing recruitment campaign for off-island care workers who will be casual staff employed through Park House. But I think you know off-island notice boards. I think once they've been up for a certain amount of time, people stop seeing it, and sometimes they're hidden. So we thought a brand new poster. I've contacted all off-island members. When you're talking to people who are looking about what they might do this winter, please raise the potential for working for Park House. They will need to come to Park House for their training, and to make it really clear that boating shouldn't be an issue there. So we will fund boating costs to access the training, because actually that's a really good use of money. Rather than paying people from St Mary's to go and deliver care, it'd be much better if there were local providers on the off-islands. So anything you can do, off-island members, if you know of anybody who's looking for work this winter, then nudge them towards us.
Chairman, I agree with that.
Yeah, I'll make sure the new poster gets to you, that's fine.
Okay.
Chairman,
Councillor Bennett.
an email to all residents is usually the way that we communicate around the island. So if you send the wording for an email, we can distribute it.
That would be good. Councillor Nellams.
Yeah, thank you. On 2.2, review of Living Well, the Living Well project, what does that mean in practical terms? Are we sort of getting our elder residents to sort of do their training, running around, eating vegetables?
The Living Well project is a project that we commissioned from Age UK. So we have an on-island worker employed by Age UK called Elaine Liza. Living Well is a evidence-based project that was piloted in Newquay, and it's now being rolled out in Penwith, where basically when you have your multidisciplinary team meetings every morning, where you have community health and adult social workers talking about your high-risk clients, you have someone who's championing their social needs, not just their medical and care needs, because it's found that the biggest issue for most people is loneliness. So it's somebody there saying, yes, okay, we'll manage their diabetes, but how are we going to get them to see their friends? How are we going to get them to bingo? How are we going to get them shopping? So they're very much championing that side of someone's life. And it has shown that if you do that, you reduce admission to statutory services. It makes absolute sense. It's exactly the model we do in children's, because happy people tend to thrive. So it's about, and I think that's the bit that we forget about for adults, that social interaction is kind of often the key reason why people start feeling worse. And so we've been running that for 2 years, and I think it's just important when we commission these services to have a review and say, is this working in the way that we want it to? So I'll make sure that that happens for the next Health and Wellbeing Board. So on Buzzer Bus, sorry Fran.
I just wanted to say on the Better Care Fund, that's an area where there is some anomalies in the budget, and that's an area that we're picking up with Aisling's team in the way that it was treated as a debtor in the past year and as income, because actually that's distorting some of the numbers in the budgets, and we need to rectify that to make it correct.
Thank you. Can I just chip in quickly with something as well, please? Which is that there is some very interesting work going on in the Somerset area with regard to encouraging people to be so-called micro-providers, whether they're self-employed, they are self-employed, but there are advantages in this, in the way that the council can offer support and training, but the person can then be self-employed, and this is more beneficial to them financially than actually working either with an agency or directly in a different, working directly for the council. It can be very advantageous to them, especially in terms of their hourly rate. And I'm trying to get some more information and working with Jim McKenna from Cornwall County Council to find out some more information to see if this would be appropriate for us. It would mean possibly, and I'm anxious that I mustn't be too overly optimistic, that we could be employing people at a rate where we wouldn't then be on the same level as housekeeping chambermaiding posts. We would be able to offer £2 or £3 more an hour, which I think would significantly impact on the number of people that might consider doing that. So that would be useful.
Chairman, I'm very taken with the idea of getting people to and from events to reduce loneliness. Who's going to champion that on the off-island? Will that be the care worker?
That's the Living Well coordinator does liaise with off-island residents as well, but that's all part of the view. I need the Living Well, because it's not a council provided service, it's a council commissioned service. I have a set of objectives, and part of that was to make sure there was equitable access across all the islands. So we'll get the review in from Age UK and see what they managed to do. Yeah.
I think with Aislinn's approval and everyone else's acquiescence, it might be a good idea perhaps to have Age Concern come and address us in February, since this scheme has been working for a while, or possibly we might, and obviously that would be in conjunction with Elaine Liza to tell us a little bit more about the project, if that would be welcome.
Right. I mean, and also to follow on that whole area of social isolation, Councillor Billsborough organised a really good meeting with Methodist Homes for the Elderly, who actually have diversified the kind of work they do, and they're kind of going into the whole area of social isolation. And they've got some really good ideas as well about how we can create more connections amongst older people. So that was really good, but that was literally last week, so we haven't managed to do anything yet, Gordon, but we're all over it. But I think, you know, anything we can do to stimulate the voluntary sector on the Isles of Scilly would be great. So Buzzer Bus, we did agree that we'd recommission the service. Having reviewed the contract with Diana, there actually is provision within the existing contract to provide for some contract variations. So we are working currently with Age UK for them to come forward for proposals for some changes to the service delivery so that we do get a new vehicle which has disabled access, and that we also streamline the whole process so there's minimal administration costs for the local authority. So as soon as I've got some clear costs on that, I'll bring that back to committee. It might be by email.
Thank you.
Could I just say something, please, Chairman?
Indeed.
I think the Buzzer Bus seems to have been going on a long time, and I think it's quite costly for us at the moment, isn't it?
Yes.
Because they're using someone else's taxi. So
Yes.
I think it seems to have been going on a long time, this. Is there any way we can sort of hurry it up a little bit?
No, but I am working on. I mean, we're working with Age UK. They have identified a vehicle that is appropriate, will fit through Garrison Arch, has got disabled access. So once they give me the costs for the total contract, I then need to come back to you, get that approved, and then we can order that bus.
I mean, I do take Councillor Mumford's point, and I just wonder if we could get anything prepared and ready and we needed sanction, if we could bring it to full council in December rather than waiting for next February. Because I do take on board Councillor Mumford's comments. I think
that would be
they're
a
very
good idea,
relevant.
because this has been going on since we discussed it in June, I think.
Well, I mean, I think the thing is the members have already agreed to a change in provision. You've already agreed to a budget. If I bring you a proposal by email, which is in with the existing budget for this year, then I think actually you might suggest a delegated decision through email, which is the quickest we could do, rather than even wait to December. Because I expect Age UK to get back to me.
Yeah.
Yeah?
And obviously it has budget implications, so the quicker we can do it, the better.
Yes.
Yes, indeed.
As you're also aware, that I did also try and get some money from the Better Care Fund to offset the costs of the service. So again, there should be some actual savings in year against the budgeted line. Then on Objective 3, develop the options appraisal. As you're all aware, that work was completed and now the really hard work commences. So I will bring you an update as that develops.
I'd just like to ask Dr Barnes, if I may, if he has any comments, because Dr Barnes was part of the committee decision when we went forward with the options analysis in February, but obviously didn't sit at full council and so hasn't had the opportunity to comment on the options choice going forward. Would you like to give us your hopeful support or comment on that, Dr Barnes?
No, I did see all this by remote control because my wife went to one of the meetings and brought the stuff back. I was very supportive of it, yes, I thought it was very good.
Good. That's pleasing, thank you. Thank you, Ashley.
Okay. Then on housing options, I think that's very much something that Diana's been all over. There's a really strong housing partnership in place now. I think the principles that underpin that is that they're developing houses for the whole community, not subsections within that and homes that work throughout a lifetime. So again, there are no promises because this is all about, you know, trying to access funds and so on, but the commitment is there. And it's not just the council leading that, the Duchy are in there and our health partners.
Sorry, and the RAG rating is continuing?
I would say, yeah, here we're green on everything, so everything's within time. Then on advocacy, sorry, Joel's initials are still there, but that's me now. Advocacy contract is in place. One of the outcomes from the audit was to make sure that we offer advocacy as standard. And obviously there are issues about how we make sure that advocates can come over to the islands in a timely fashion, but it is a very strong contract. Carers' work is continuing as normal. Mental health needs, there is, I would say, on 5.1, we probably might put a red against that. There has been some delay in commissioning activity to take place, and that's been around the whole area of the Better Care Fund. The Better Care Fund hasn't been a simple thing to organise for the Arts We've had very little engagement with health partners, but I think we're beginning to wrestle it to the ground. As soon as the funding is confirmed, we will be able to ring Cornwall Foundation Partnership Trust and commission an enhanced level of services for the islands.
Councillor Mumford.
Yes, I think that's another thing that needs to be chivied along. We seem to have been waiting a long time for this. Does that involve CAMS?
No.
No.
So this is for adults. But the Better Care Fund has been an issue, but it's been an issue in how it's set up in the budget and an issue in actually claiming the funds against commissioned projects. We're getting there. It's another one of those endless conversations.
I think you're right in a way to mention CAMS in the sense that the provision of adult support for people with mental health issues is a problem running right through the age range. So in that sense, we've got issues at both children and adults level. Councillor Daly.
Chairman, I'm attending a meeting in early December of the governors of the Trust, NHS Foundation Trust. Should I be raising it there?
Well, let's see where we are by December. I'll make sure you have the most latest up-to-date position. And this isn't an issue with Cornwall Foundation Partner Trust. I mean, it is in terms of the fact that provision of mental health services isn't robust across the country. But this specific issue, which is about us commissioning an enhanced level, so i.e. we get a mental health worker to come here more often during the month, is all to do with making sure we've got the funding to do so. I don't want to commit the local authority to commissioning health services when I haven't got the Better Care Fund to support it. As you can imagine, that's too risky for us.
Okay, thank you.
So it's more about the CCG, this one. Then the work around dementia, again, we've done some really good partnership work. Sorry, Steve. Oh, God.
Sorry.
Chairman, a small general point which I've noticed. If you look at the column in one from the right, it says resources. And going through all this document, the resources are going to be met from existing budgets. Now, if that's true, it gives me a warm glow that we have enough money in all these budgets to meet it. If this is, well, if you read that down, it says, yeah, it sounds we're all right.
No, I mean,
there's plenty of money. Is that true, Chairman?
Well, then it doesn't all say existing budget. Some of it says Better Care Fund, and that's the critical issue about why I've held off commissioning some services. Existing budgets, as in the budget approved for this financial year, we are working within that budget as much as possible. But as you know, we have to have a conversation at some point about the cost of Park House.
Thank you.
Is it possible to get funding for the, for the, you're saying about the mental health programme? Is it possible to get sort of central government funding for that kind of thing, or does you have to finance it out of your own budget?
Well, that's what we're using the Better Care Fund, which is a Department of Health grant, which moves money from the health service into local authorities. So that's what we are using for that. There isn't another separate pot that we could bid for.
No.
In children's services, there was an increased amount of money called the CAMS Transformation Fund. We have made a bid for children's, but there's nothing equivalent for adults.
No.
I mean, when we move forward to work in an integrated way, some of the pooled budget should actually help us access and have a bit more discussion with our health colleagues as to how we might better support mental health provision. I think. Do you agree, Ashley?
Yeah, absolutely. Then on work on dementia, we've been working with the Alzheimer's Society. They've held some consultation events on the islands which have been very well attended. They've got some good info back. They have developed a proposal for an on-island dementia support worker. And again, that's a really good idea, but we have to think about whether we can afford it. So again, that's going to have to be fed into budget setting for next year. Then autism, I would say, is red currently. As you know, this is a piece of work that I now have to pick up because of some of the staff changes. We have a statutory obligation to have an autism strategy for both children and adults, and we don't. And I don't want that to carry on being the case. So to be pragmatic, on the adult side, I've made contact with Cornwall, the Cornwall Partnership, not Cornwall Council, Cornwall Autism Partnership, about developing a strategy, an adult strategy with them. And to be honest, there is a kind of logic to that, because a lot of our adults with autism will access health services on the mainland. So actually being joined up in that way isn't a bad idea. And we'll probably do the same for children's. The view is then in 3 years' time we'll have a joint autism strategy for children and adults, which is the kind of the key aim. But autism work definitely, I think, has suffered from some of the kind of capacity issues that we're finding currently within the local authority. So we're just trying to find sensible solutions to make sure we meet our statutory obligations.
Thank you, Aisling. I do think it also, we have to recognise that sometimes we're just too small. There's a lot of work going on in the area of autism at the moment. It's extremely interesting. But obviously we haven't got the resources, the man or woman power, to actually keep abreast of all this research. So I personally am very supportive of joining with Cornwall, because they've got more resources, and also they've got a wider client base that will impact on their service provision. It will feed into different ways of handling different aspects, and I think it will be something that will be beneficial for us.
Thank you, Chairman. And I think that's the thing when we look at, with this whole point about existing budgets, Gordon, I think when we're doing budget setting for next year, we might have to cut our cloth accordingly. This is a very ambitious service plan, and actually we might need to be much more realistic about what can be offered, and particularly around timescales, because some of this stuff you can still do, it's going to take a bit longer. So then residential and community care, as you know, we have just got good from CQC for everything. So that's fantastic. Less than half of care homes across the country get good. It's a really, really strong achievement, and they said it's a strong good. But that masks the fact that, again, we have got recruitment and retention issues in Park House. So we've got a whole risk management plan in place. Our residential care manager has left, registered care manager has left. We've got a locum in for 3 months who's excellent. But of course, that's not it's not the way we want to progress, because locum staff do cost us more money than if we can recruit locally or have somebody here based permanently. But obviously, in terms of making sure that the service still runs, we have to have a registered manager. So we've got one in place for the moment. So when we are clear on the budget position, we'll bring that back to you.
Can I just say something? Yeah. The budget that was set for Park House had really, really challenging income targets that were not attainable and would never have been attainable unless almost everybody was self-financing. Therefore, it seems logical for us to look at those and bring it back to you in December and say there's no point in having an unrealistic income target. It's better to have a realistic income target and understand what the impact on the global budget is, rather than turning up in March and going, oh, we didn't hit that target. So that's what we're going to do in December, and have an entire look at what the impact of that unrealistic income target on Park House, because Park House's expenditure is on the button. Its expenditure isn't an issue. What's an issue is its income target. So what we have to do is reassess the income target that was given to Park House, reassess the implementation of the Better Care Fund, which I think will give you a much better idea of exactly where we are in adult social care as far as the budget's concerned.
So just to use a colloquial term, are you implying that we actually shot ourselves in the foot a bit by expecting that more people would be able to self-fund their residential placement, and they weren't able to do that?
I wouldn't like to say shot ourselves in the foot, but it wasn't necessarily a very attainable target, and we need to make it. There's no point in setting yourself something that you can't reach. Yeah. You have to be realistic, otherwise your budgets won't balance.
Absolutely. Councillor Manford.
What about housing for the new person who's in Park House, the new manager? Do we have a house put by?
We found something for the time being. Yeah. In terms of the future, we're working really closely with
the housing.
Well, it's housing, but it's not really housing's job. But we're just anybody who's kind of got their fingers on the pulse of what's out there. We're talking to. And housing has happened to be one of those people, but they obviously haven't got.
This is our big problem, isn't it?
Always.
And for the carers as well, carers workers.
Yep, always a problem.
Chairman, this question of the income, is that related to the fees and charges that we set?
No, it's to do with the fact that there was an unrealistic level of income expected. Even if everybody was a self-funder, which is highly unlikely, we wouldn't quite have met that income target. It was just too ambitious. looking at the numbers of people that would be in there, so even if they were self-funding or not. The fees and charges have gone some way to addressing the cost of the service to the local authority and was appropriate, and the LGA have said so. Hard decision to make, but an appropriate one, and now we are more in line with equivalent homes on the mainland. But on top of that, there just was something lost in translation between all the income modelling we did for February committee and then what was actually put into the budget at the end of the financial year. And we're unpicking that now.
Councillor Beresbury.
Yes, I think I'm right in saying that for a person in Park House who is self-funding, it's going to be or is about £1,000 a week. Right now, it is quite conceivable, as time goes on, that you may have Park House full of people who are unable to be self-funding because finding £1,000 a week isn't easy. In that case, what are we going to do about it? I think we have to go to the government and say, look, we cannot manage if they are not all self-funding. And very few people can afford £1,000 a week before they die.
So those people who cannot afford it will undergo a financial assessment, and where they can't afford it and where their income falls within, they've got more than 23,000 they have to pay, but less than that, the local authority pays. So we have a separate budget, as you know, Gordon, which is our commissioning budget, where we actually do support the people who can't pay, which we're doing currently.
Yes, because as it is now, they get support until they have, I think, about 23,000. They get no support. In between 23 and 14,000, they get some. And then after that, they have about 14,000 left. And to be quite frank, a person who starts off with all their savings ends up with just enough to pay for their funeral and not much more.
That's the law. And if members feel strongly about that, that's a conversation with the MP to take to government. That is the law, and those are the laws that we have to apply on the Isles of Scilly, as well as anywhere else.
Yes, we're no different from the rest of the country, and I think it's an ongoing debate that is currently being held at Westminster. But Westminster is the place I would respectfully suggest for your question.
I mean, good as I am, So where did I get to?
At the top of page 5.
So 6.12, so I explained some of the kind of staffing resilience issues, and then on the work with housing, again, working really strongly with the housing team, we've got a draft policy in place, but again, it's all about time, because we're talking about a tiny team, so it's not happening as quickly as we like, but it's on the list. Then health and well-being. This is again about the Better Care Fund project. So that was all about early intervention services. So obviously this is where Councillor Coombs can't talk, but we have successfully awarded that contract to Helston Medical Centre. So it will be run locally. A physio has been employed, and I think once that bed's down, that's going to make a significant impact to the outcomes for older people. We could be able to get in early, and people will have access to physio and assessment and planning from the very big outset. So that will be a 2-year project.
Councillor Mumford.
I'd just like to say what a good thing that is to have the physio here for mobility problems. It's going to make such a difference to such a lot of people.
Yes. An alarming amount of people actually fall after they come home from hospital, so this should help with the re-enablement as well. Councillor Bennett.
7.2, the aids to daily living and so on. Do we still use equipment provided by organisations like Rotary and Freemasons and so on? Because they used to have a very good input into the provision of
They still have their stock, and we do signpost people. The stock we're talking about here is what we share with the hospital, and there are loads of regulations around that, about how it's got to be cleaned and managed and so on. So it's slightly different. But we do
the regulations cover how it's paid for initially, though?
I don't know, Councillor Bennett. But we have bought a whole load of new stuff, which has gone down very well, and that has been funded by the Better Care Fund.
Could I just say that the Rotary do have wheelchairs?
Yeah.
And you make a donation?
Yes.
Thank you.
But that's kind of separate to us, so but we do signpost to that, and they're fantastic.
Chairman.
Can we make sure that stuff that goes out on loan, that it is quite clear that it needs to come back once it's no longer being used?
Yeah, the stuff that the hospital and adult social care share it's all very regulated and registered, and it's all managed through people like
Well, I
physios
make the comments based on recent personal experience. That's
right.
why.
Okay.
Yes, I can imagine.
Thank you.
Yeah.
Okay. Right, I'll chase that up. Then public health, again, that's now moved back to me. So we have most of these services are mandated through, are commissioned through a contract with Cornwall Council, and we basically just cover up the mandated services, and that's all progressing as planned. Winter Wellbeing, Jeanette's doing quite a lot of work on that, and there's going to be a health fair next week. And people will be coming around to do the energy efficiency checks for householders. And I think last year, I think Joel talked about somebody saved £1,000 a year just by switching provider and doing a couple of cost-saving measures in their home. And I really like this piece of work because I think it's really practical and it makes a difference straight away. And then Health Watch, again, we're just trying to find a little home for the Health Watch contract. It's likely to be Bob Dawson, who, as you know, is the officer supporting the Health Scrutiny Committee. Currently, there are no kind of red alerts around Health Watch. They continue to provide a really strong service, but obviously I can't manage the Health Watch contract because it's a conflict of interest, because they're meant to be holding people like me to account.
Excuse me, we're still running on green, are we, with our RAG ratings?
Yeah, so green. So I think your reds only sit around autism and, what was the other one I said? Mental health.
Yes.
Yeah.
Fine.
And I think then I now hand over to my lovely colleague. No, I don't. Healthy living. That's Teo.
Yeah, I'll try and pick this up as best I can. I'll do this as best I possibly can. Teo's not here today. My understanding is that this is going along as it's always pretty much gone along. We have had a plan presented to CLT. I think that plan needs some extra work, and we need to particularly understand how it impacts on future budgets into next year. And I think that that's a really important piece of work that we need to pick up. I think that there are discussions to be had about how we maximise Active Scilly's generation of income and how we make them concentrate on those things that maximise income. One thing that is going ahead as we're going along is the move of some of the one-stop shop, not all the one-stop shop services, but some of those services and reception to Carnguaval, which will have an impact on cost savings because it will save costs, and we're moving ahead with that. I'm sorry I can't give you much more information than that. It's not my service, and I only know the peripheral edges of it.
Has this decision to move the one-stop shop, or most of its functions, to the library, has it been approved by members, or is it just an edict?
Councillor Billsborough, excuse me, March the 8th, I think you will find full council. It was part of the savings plan that we approved, I think. Chairman, can you also recollect that? Yes. So the answer to your question is yes, it was. Thank you. Could you give us a little bit more information about the funding when the Active Scilly staff take over the delivery of re-enablement? I think this would be a really good illustration, and it works so much in line with the aims of the Sustainable Transformation Plan, which is that health and social care integrate and work more closely together. This would presumably generate us some income from the health budget.
Well, I mean, it's about an exploration.
Yes,
the health staff have to be trained in order to deliver it,
sure.
And it's all about whether or not we've got Better Care Fund available to do it, because that's the only fund we can use to commission those services. So I think that's an idea, and that would be a way of joining up the services, but you have to make sure that Active Scilly staff can deliver the enablement services required by health at a safe level. But definitely a good idea.
Thank you.
Thank you. Sorry.
If we move on to learning in library, which now does, for after the last 3 weeks, does fall under me. If we start with objective 1.3, which is about learning, I think it's important to understand that what we've started to do is integrate better learning and development and the resource that sits under there, which is for our own staff, and lifelong learning, so that they work as one team together down at the Lifelong Learning Centre, because that gives more resilience to learning and development and a lot more resilience to lifelong learning, and has a potential cost saving as we move forward. of about 1.2 posts. And I think that that's something that we can look at as people have moved on to other jobs. Sorry, I'm short-sighted and long-sighted with my glasses, so I'm all over the place. Accessing external ESF funding is going to be more complicated because of the Brexit decision in June. We're unlikely to get a separate project for the Isles of Scilly, but we are looking at how we can properly integrate with the provision that's on the mainland. There may be some access funding for us, but we're not sure how that's going to happen. And I think until we get to the end of November, when there's an ITI board, we're unlikely to know really what's going on. I can't give you more clarity than that. It's just where we are in that process.
ESF is European
Social Fund. So okay, it pays for, it's about £132 million for Cornwall and the Isles of Scilly, which looks at training and skills and access to work, so DWP focus. Lifelong Learning have been working very closely with the Growth Hub, which is around business support, and they've been working hand in glove with the voucher scheme. So there's been quite a lot of linkages between the voucher scheme, which gives grants to small business, and lifelong learning and the Growth Hub. The Growth Hub is paid by European Regional Development Fund. Objective 1.4, which is the universal learning to overcome social and geographic isolation. This is funded separately by the Skills Funding Agency, and they give a grant of £93,000 per annum. And pretty much that covers that whole area of work. And actually, the budgets are looking very good for lifelong learning, because we've amalgamated learning and development and lifelong learning. That's made substantial savings. We can intensify the work, and many of the courses are self-financing, so it works very well. And I think that you can see from the amount of stuff that they're getting through, that's really starting to kick off again this winter. And the library service, I think, goes from strength to strength. It's been very busy over the summer, and as it says, 106 people taking part in the year's summer reading challenge. And I think actually having some of the service from the one-stop shop in the library will increase footfall and people who wouldn't necessarily have gone to the library.
Yes, I think we ought to note and send some congratulations. 106 children taking part in a reading challenge, I think, is when you think of the amount of children that we've got on the island, and the fact that it was done in their summer holidays when they might have been going out and doing other things is really very good. So that's great. Thank you.
Right, and to support training and development needs of the Council of the Isles of Scilly, this is where we've got the amalgamation of the learning and development function, which did sit under HR, with lifelong learning, because it seems silly in some ways to have them separate. And when we had the audit, that was something that the audit suggested. And it just makes managing courses much, much easier, and managing training that much easier, and that's been very successful. And Helena and Alice have moved down there, so for staff, instead of ringing them in the town hall, they ring them down in lifelong learning now, so that's kicked off quite well. And now housing. We've now undertaken the survey of all our heating systems. We now know what everybody's got, the good, the bad and the ugly, and there's been some pretty ugly ones in there where we've discovered people have hooked up appliances they really shouldn't have hooked up into their social housing. We're doing all our compliance checks, so we have an annual review of all our compliance checks, things like chimney sweeping, fire safety visits, electrical upgrades. So as soon as we have any voids, we go in, we check all the electrics, upgrade all the electrics. It means that we've got a rolling programme of improvement. And people who have to be, we don't put any gas appliances into our houses, but some of our tenants do. So it's about making sure that they undertake compliance checks on their own kit and equipment, because obviously that can be a risk to other tenants nearby. All our EPCs, our energy performance certificates, are now complete. We've got somewhere in the region of 23% of our stock which is below the limit of an E. So those will need intensive work to get them above an E, because if they're not above an E, we can't let them new come 2018 and not at all come 2020. So that's quite a big piece of work, but that will be linked into the Hitachi project and the solar panels and energy efficiency and installation and things that come through that. We've had 76 responsive repairs with external contractors and over 100 with operational services since April 2016, that should say. Sorry about that. That would have been a bit weird. But it goes to show the amount of responsive maintenance we do on our housing. So people ringing up with broken taps or electric's not working or whatever. And what we've done is we've invested in kit and equipment and training for our DLF staff so that they can undertake this work. So things like laying of vinyl for the kitchen floors, basic plumbing skills we've paid for them, and we've also bought them a new machine to clean guttering, which is a universal problem for us. So it's things like that. And we've just gone out to contract finders, so out to tender for long grass. So can you please encourage all your friends and families who may be builders to please apply for that contract? We hope to get that completed by March, the works. Housing register and homelessness. We do a yearly update of registers just to check do people still want to be on the registers or don't want to. And we've asked everybody who's under occupying to consider downsizing into a smaller property and shifting. And we've had one response to that, which I'm really pleased about. It's actually really hard for people to make that decision, and it's excellent when they do, because it means that somebody in a much too big house can move into a smaller house and the larger family can move into the bigger house. But it's something we can't force people to do. It's a completely voluntary thing, but we can encourage it. We've had 2 Isles of Scilly council houses become void in this 6-month period and 4 housing association properties, and we rehomed out off of our registers. And we've been working on homelessness, and we've spent less than £5,000 on homelessness this year, and we wouldn't expect to spend much more into the future. But we do have the odd case turn up that we need to deal with on an ad hoc basis, and we work very closely with adult social care and health professionals on homelessness and vulnerability around that area. And obviously, Ashton talked about the housing partnership. We meet regularly. We talk about both the local plan, housing sites, and moving forward on housing. Councillor Grottick sits on that committee, as does Councillor O'Neill from a planning perspective. It's not a committee, it's a partnership, and that's moving quite rapidly. And we're in conversations with the Homes and Communities Agency about what resources might be available post the November budget, where there is a opening up again of affordable homes, which was closed down in favour of starter homes previously. And the demolition company are on site knocking down the secondary school, hooray, which I'm very glad about. And we're trying to keep up as much as possible with the latest legislation on housing and how we move forward with that. But it's worth saying that we are likely to have to be subject to paid to stay, which means that if you're in a council house and you have earned over £31,000, you will have to pay progressively a market rate, so equivalent to Dutchy or whoever, and that decision is triggering more interest in right to buy, and that's kind of inevitable, really. As people see the possibility that their rents will go up, it triggers an interest in right to buy.
Chairman, one question. On page 19, we're talking about managing the social housing. You mentioned in it chimney sweeping. Do we have any chimney sweepers on the island?
Yes, we have a registered. There's a special registration you have to be, but you have to be a registered chimney sweep.
I didn't know. No.
And somebody who's able to do flues and things.
Thank you. Sorry.
Thank you, Councillor Daly.
Chairman, I'd like to know if there's any sign anywhere of our housing policy. It seems to be in a constant state of deferment. Are we ever going to have one, do you think?
I understand there's a local plan subcommittee or working party will be held very soon, so hopefully we will be able to move forward. Chairman, that's correct, is it not?
No. Yes, it's work in progress. It's with Mrs. Walton.
It's due out in March, I believe.
Yeah, the local plan...
I'm not sure which year.
Yeah, the local plan and the housing policy have to go in hand in hand. There's no point in doing a housing policy in isolation from the local plan.
The other thing, Chairman, throughout this report from Aisling, I get a feeling there's a tendency for more and more work being loaded on Aisling, and I'm wondering if it's unfair.
I think Diane is having exactly the same issue, and I think this is the fate of local government officers. Not much we could do. Do more with less.
It is a concern, isn't it, moving forward? Councillor Bennett.
Just going back to the pay-to-stay legislation, does that cover housing association rents?
There's some discussion going on about that. The government haven't done its full analysis of it, and we were supposed to start in March this year, but it now looks like it might be pushed back for 6 months while the government works out exactly how we do this, because it's a huge administrative burden for both housing associations and councils if you then have to dive into people's finances to work out if they earn over £31,000.
I did read a report, sorry Councillor Bennett, that if you didn't actually fill in the information by the date requested, it would be assumed that your income was above a certain level, which does seem to me, it might sound a bit draconian, but it seems to me probably the only fair way of moving forward.
And it's worth noting that the money goes back to the Treasury. We don't keep the money. So there's no financial gain to us.
It's just that you said to keep in line with market values, quoting the Duchy. Well, here there is an enormous discrepancy between Duchy and housing association rents.
Housing associations have got something called an affordable. We have a social rent. Then housing associations have an affordable rent, which is approximately 80% of open market rent, and then there's open market rent. But I think all of us would acknowledge that probably housing associations are not 80% of what the open market rent is. The open market rent has gone up substantially because there's so few rented accommodations available.
Can I ask what the status of our general fund housing? Obviously our social fund housing will be covered by this legislation. Our general fund housing is different, isn't it?
Our general fund housing, if it's a mixture of things. Some of them are on affordable rents and some of them are on open market rents, depending on the tenant. So some of our general fund properties have council tenants in them, and those we treat as affordable rents, the same as housing associations. Our social properties have a social rent, and then our open market properties, which are for staff, pay an open market rent. That sounds horribly complicated, but it's kind of what we've inherited.
And it's not going to be easy, but obviously some of it will be beneficial. I'm just sad that the income won't come back to the authority and that it will go immediately to Westminster, which doesn't seem fair. Vice Chair.
Yeah, I agree that it's invidious. It looks like a good idea, but in fact the execution of the whole thing is just dreadful. It's counterproductive for local authorities. Local authorities look like the bad cop. They got all the flack and the government gets all the money, so it's not happy.
I might suggest. Yeah.
To the point.
Right. Is that the end of your current contribution?
Yes, thank you.
Has anybody anything else to offer on what was a very meaty report? Thank you very much to Mrs. Montfloki and Mrs. Hugh. Chairman.
Just to say thank you very much for such an in-depth report to both officers. Thank you, and all those who've worked on it. Thank you very much.
Yeah. Absolutely. Second it.
And thank you for the acronym guide.
Yes, I appreciated that too. Vice Chair.
The budget monitoring report does need to come to this committee, and I don't think we really can hang on to it till February. I think we really possibly could do with another meeting in the nearer future than that, because I think because it's 7 months in now, we do need to look at these figures.
Can I suggest what I'm doing at the moment is going through all the budgets. So, and I have to say that there are significant issues with the this particular budget, which I'm trying to iron out at the moment. What I intend to do for all the budgets is bring in a budget position to full council, I think on the 6th of December, is it? Full council, which sets out exactly where we are as a council across all of the piece. And we should then also have the input from the LGA on our budgets as well.
Chairman, with all due respect to the officers concerned here, I am concerned. There was no finance meeting in September. It was just cancelled. I don't know whether the chairman of finance can enlighten us on that. For a start, and I'll carry on.
Finance.
Yes, it was cancelled.
Why?
Oh, you want more?
Well, I just want to know why.
Well, Ben, finance officer at the time, approached me in August, said there wasn't anything to go to it, and it'd be best to all go to full council. Now that was basic, and so I just did query him on it, but there was some other things wouldn't be ready. The audits and everything wouldn't be ready, so he said it'd be better to go to full council. And these things did go to full council. I wasn't very happy with it. However, Ben would have been the person delivering the reports. The elder care options weren't even on my radar. Then it came up a few weeks later. Then this is early August. Ben spoke to me about this. This is why we didn't have the FAS, and I think we do need one soon.
So when is the next meeting of your committee?
I'm not sure. We need to. I need to organise one fairly soon.
And I'm also amazed, Chairman, that there's nobody here from finance. I'll be quite blunt.
I am.
No. Seriously, from the finance department.
No, I am responsible for finance. I'm the senior manager for finance. So what I would say, Gordon, is that we've prepared budgets for every other committee that we've had, IFCA and Teddy. But because there are these anomalies with the Better Care Fund and the Park House income, if I'd come to you with those budgets as of today, it would have distorted the true picture. And actually, I'd rather give you the true picture than give you a distorted picture. Either the one that was too positive, because it said we're going to make loads of income and we've got the Better Care Fund as income and we're all lovely, or that was too negative because I couldn't work out exactly where we are. So I've done budget monitoring for Teddy, I've done budget monitoring for the IFCA, and I will do budget monitoring for every other committee. But this one, because I work closely with Aisling on it, the decision was taken that because we couldn't give you the true position because of the way that in the original budgets, the Better Care Fund and the Park House income had been put in, we needed to give you cleansed budgets which explained all of that much more clearly than I could do with the pivot tables that we had.
I'm not criticising you. All I'm thinking, I have the impression that we were going to obtain the services of the Deputy Finance Officer of Cornwall.
Yeah, we have, and he will be here in December at full council when we provide you with all of the numbers for the part year. But unless you want to spend an awful lot of money, he won't be able to come to every single committee.
So we have a finance person here, and we can't expect them to attend a meeting because they're in Cornwall. Is that correct, Chairman?
No, what I'm saying, Gordon, is if you've got any concerns or worries, please come and see me, just like I've done with Councillor Grottick and I've done with Councillor Sim. Come and see me. I will go through every set of budgets with you. That's not an issue. We have the figures. It's just that on these two particular areas, I want them to be right before I give them to you, because it will just set hairs running all over town otherwise.
Can I just say, we will receive this budget monitoring report, as I understand it, in a short space of time. Is that not correct?
Yeah.
And then afterwards, the Vice Chairman and myself, in consultation with the officers, will decide how to take it forward so that you will have the opportunity to comment.
All right.
Councillor Mumford.
Is it possible then for us to have a meeting before the full council on December the 8th?
I would have thought we could possibly
just
twin
a
it
short
with
one
that
for
day.
the budget
yes,
only.
That's exactly what I was going to suggest myself. Yes.
If you just want a budget meeting, we can do that potentially in November.
Either that, or we could have, as Councillor Mumford suggested, and I was going to suggest, immediately prior to save.
Yeah, even if it's just a week before. If it's a week before.